Hello, brilliant diamonds. Irene Diamond here. Welcome to Diamond Method Mastery Academy. Today's topic, short and sweet. Simple? I don't know. I prefer to think it's simple. Many providers don't even consider it. They don't even think about it. So today we're going to talk about this concept of clarity of purpose. Clarity of purpose. In other words, being exceptionally clear on the purpose that your client / patient wants to achieve or relieve. Clarity of purpose. Why are they coming to see you? Why are they booking an appointment? Why are they walking into your office? Why are they meeting you over video visits? What is the purpose of their session? What is the purpose of their treatment plan? What are you trying to help them relieve or, relieve or achieve? Relieve or achieve. Remember, we always talk about relieve or achieve. There has to be a goal. The goal has to be understood. And I see this happen too often where people book an appointment or their front desk books an appointment with a provider and the provider really doesn't know why the client's coming in. Obviously, they can find out, and they should find out once they've been taught, once the client walks in the door. But let's back it up a little bit and make sure that the appointment is actually scheduled appropriately in the first place. So whether you're doing your booking or your front desk is doing your booking, make sure that before you have an appointment, either over the phone or through email, have a conversation around the purpose for them to see you. So I saw this happen the other day. I always tell stories because I think it emphasizes the importance of the topic. Somebody was talking to our front desk person, Sarah, and God bless her, I love her, but she's learning about clinical operations and sales conversations. She's talking to a person who is a runner and he's had knee pain for a long time. And he's telling her about how I just hear her side of the conversation. I'm not hearing his conversation. I talked with Sarah about it afterwards, but she's repeating back things as she should, saying, oh, okay, so you have knee pain and it's been going on for, X amount of months. And when I asked Sarah afterwards, well, what is his goal of the session? She didn't know. And so I said, well, that's a problem. We need to know why they're calling, not why they're scheduling, why they're calling. What do they hope to achieve or relieve? Remember, we always talk about those two terms. They don't just come in because they want to spend money. They don't just come in because they want to hang out with you. They don't just come in to, take a nap for an hour. They come in because they have something they want to achieve or relieve. You need to know what that is before you schedule them. How, like I said to Sarah, how do we know should that client see me or another provider? How do we know if that client should see me for an evaluation or a standalone session? How do we know if that client needs a full program or a single appointment? How do we know if that person needs a video visit or an in-person session? We don't until we know what their goal is. We can never assume what their goal is. So Sarah goes, well, I'm guessing it's pain relief. How do you know? He said he has pain. Well, yes, but that doesn't mean that's why he wants to see us. Obviously, pain relief would be great, but maybe he's got a marathon coming up in 2 weeks and he needs to train and wants some strategies around stretching, strengthening. Who knows? I don't know. We don't know. We can't guess. We need to ask. So literally, in your pre-appointment conversation, you want to ask, what is the purpose? If we are to accept you into our practice, what would be the purpose of this session? And I know it, like I said at the beginning, I know it seems so simple, but it's not simple in the sense of the whole therapeutic approach. You have to have this answer. What is the purpose? Now, if we go back to the client or the person, the lead prospect, they haven't come in yet. The conversation is, let's assume the guy's name is John. Hey, John, what would be the purpose of you coming into our practice? And then he'll say, well, my knee is killing me. I want to get rid of the pain. My knee is swollen. I want to get rid of the swelling. My knee is stiff. I want to get rid of the stiffness. I've got a event coming up. I've got a vacation coming up. It hurts me when I sit in my car or drive. We don't know. We can't guess. So asking very specific questions I know a lot of therapists tell me they feel like they're being too pushy. Well, you say it in such a way, and again, this now transfers from clinical competency over to business practice management. But the questioning comes in a way that's respectful and thoughtful and helpful for them because it helps them get more clear, as well as helpful for you to be able to decide where they should be scheduled. What is the purpose of your visit? If we are to accept you in as a client, may I ask you a few questions? What do you hope to achieve? What do you hope to relieve? What is the goal? How soon are you looking to have that happen? Now they may say, well, I've got a vacation, or I'm getting married, or, if it's a pregnant woman, well, I want to be healthy through this baby, through this pregnancy and delivery. So we want to know timeframes. How urgent is it? How long have they had the problem? How long have they had the goal? How long have they wanted to address this? Those questions will help you be, I can tell you, those questions will transform your practice from being an average ho-hum clinician to somebody who knocks it out of the park, because you know what you're working with them to achieve or relieve. You know what your goal is. You're not just winging it and wishing that something good comes out. You've probably heard me say this before, and I'll say it again. When I've asked therapists who've worked at my center over the last 25 years, and sometimes I'll say something like, well, how did it go? And when they respond, well, I think it went okay, I want to slap them. What do you mean you think it went okay? You need to know it went okay. And what is okay? Well, okay is that we got a result they want. How do you not know? How do you finish a session and not know that the client got the result they wanted, or at least got closer to it? And now we build on that. That clinically is paramount. If you're not addressing the proper concerns that they have, then you're just guessing. No wonder they don't come back. No wonder they don't refer. No wonder they're not so excited to say, well, I'll book another appointment. So it's about the conversation. It's about having the utmost responsibility for helping your clients get their clinical outcomes, not just taking their money, not just booking an appointment for the hell of it, not just, feeling good. Oh, I did 5 appointments today. Who cares? If those 5 clients did not get closer to their clinical outcome, what a waste. What a waste for you. What a waste for them. What a waste for their money. What a waste for their hope that there's actually a solution that could help them feel better, move better, breathe better, sleep better, enjoy their life more fully. So unless and until you're really clear on the clinical outcomes that you can help support your clients, I'm going to be straight out and say, don't book appointments. Unless you just want to be, somebody to pat them, somebody to spend an hour with them, or half an hour or 90 minutes. Even people, because I work with a lot of massage therapists, even clients who come in who say they, air quoting, just want to relax. Relax is a goal. Why do they want to relax? Well, they're in grad school and they've got this paper and these final exams. Well, they're getting ready for their wedding. They're going to have a baby. They're getting a divorce. Their house just burned down. Maybe we should know why they want to relax so we can help them better? I don't know about you, but I don't think that's too far-fetched. So we're not clinical psychologists and psychiatrists. We're not trying to psychoanalyze them. We are literally asking questions to get the actual answer, because we don't have a crystal ball and we can't guess. We can't assume. We need to be very clear on why they are coming to you. Remember, so many, at least for me in my case, I see people who are sort of like at the end of their rope. Their surgeons have said, we need to do surgery. Their doctors have said, you just got to live with it. They're tired, they're exhausted, they're frustrated. They've maxed out their credit cards and their bank accounts. Many of them have just literally are this close to giving up and saying, well, I guess this is what I have to live with. So I truly believe it's my ethical responsibility to find out, what are they really trying to achieve? What do they want to achieve as a goal? And what do they want to relieve? Sometimes they go hand in hand. What are they trying to achieve? A full night's sleep without waking up in pain. What are they trying to achieve? An easier labor and delivery. What are they trying to achieve? Faster speeds. What are they trying to achieve? I don't know, sex without pain. What are they trying to achieve? Driving to work for an hour without having to stop to get out of the car to stretch. Those are all goals, yes? What are they trying to relieve? Swelling, pain, stress, anxiety, relieve stiffness, relieve reliant on pharmaceuticals or injections. All of these goals come into play from the very first conversation that you have with a client before you schedule them. Do not schedule them unless and until you know what their short-term goals are and ultimately what their midterm and long-term goals are. But what's the goal for that one session? What's the treatment plan, the therapy plan for that one single session? Makes a difference. If your client finishes that single session and says, wow, that's great, thank you. Thank you for listening to me. Thank you for understanding. Thank you for helping me get closer to the outcome I wanted. That's a slam dunk. That's a win for everybody. That's worth charging for. That's where you have such a wonderful sense of professional satisfaction and accomplishment. When each and every single client finishes the session and says, thank you. That's where the referrals come. That's where they go back and they tell their doctors, my gosh, I'm so glad you were able to connect me. The providers who struggle are the ones who don't ask these questions, who don't really know why the clients are coming to see them. So like I said at the beginning, it's simple, it's easy, and it's so complex. But I hope you agree that asking and getting really clear purpose for them to see you for this very first visit, it's so paramount. Now, also, let me just remind you, you might have a client who you haven't seen for a couple weeks, couple months, couple years. Don't assume it's the same reason when they come back. Ask again. Now, I have a 10-step sales circle I teach. We have a truth selling conversation of selling that I teach. There's all different ways of really getting to the nuggets, getting to a super clear picture in your conversations with people. But you've got enough information right now from this little mini training on how to get clarity of purpose, how to ask the right questions, how to not schedule them unless and until you are super clear on what they want. It's also your ethical responsibility, because what if they say they want to train for a marathon and they come to you thinking you're going to help them train to be a more effective athlete? Well, if that's not your thing, but they think it's your thing, this is your chance to say, you know what, that's not my thing. I'll refer you to somebody whose thing it is. I know a colleague down the street who's perfect at this. So it gives you a chance to not even waste everybody's time and have them be more frustrated and waste their money. Because again, if you ask the right questions, you can then refer out if they're not your best fit clients. So in my precise private practice, I only accept clients who have a goal that I can help them achieve or relieve. I don't do relaxation sessions anymore. I haven't done that for 20 years. I have people I refer them to. I have the other providers in my office who I refer them to if that's why somebody's coming in. And just like they refer to me if somebody has a migraine or neck or back pain or sciatica, because that's my specialty. But I'm not going to help somebody just relax. I'm not going to help somebody lose weight. I used to. That's not my thing anymore. Nutrition, fitness, all that used to be part of what I did, but now I've even narrowed it down even more. Improve mobility and function, decrease pain and migraines symptoms. That's my thing. So I asked the right questions, then we know. Sarah asked the right question. She went back to the client. She left a message, but she said, you know, please give us a call so we can get clear on the reason for your visit. So once we know, then we can figure out who to schedule that client with, right? It's again, something I really encourage you to pay attention to. I don't know very many schools, clinical schools that emphasize this as much as I do. I don't know anybody who teaches the clinical component as much as I do when it's about appropriate booking, appropriate scheduling. So many people just talk about, you know, get your schedule filled, pack in as many people as you can to make a lot of money. Okay, that's great, but that's not an ethical, responsible provider, in my opinion. So if you like what you're hearing, please take this into your practice. Please use it. Let me know what you think. I'd love to have you reach out to me and share your experiences with this. If you're already doing it, kudos to you. You're brilliant. If you have not considered doing this and are now thinking about adding this component of pre-booking conversations, consultating, it's called consultative selling. I didn't make up that term, but it's literally selling. When we book an appointment with a new client, we are selling an appointment. It's consultative because it's only sold to them. It's only booked if in fact you're the best fit for them and they for you. And that's why I can offer 100% guarantee, and I hope you do as well, because it's a best fit client. Then you can of course guarantee the clinical outcome. It's just a win-win all the way around. It's better for everybody. Your referring partners will love you because they know you'll ethically only accept clients who are the right fit. You'll feel better about yourself professionally. You'll be thrilled to see the results you're able to help your clients achieve. And they'll be thrilled and they'll start singing your praises and are happy to refer. And as I always say, happy to refer, stay and pay. They're appreciative. They appreciate your honesty. If you can't help them get there, don't book them. So thank you for watching. Again, I look forward to hearing from you. If there's anybody who you think should know about this type of content and conversation, please send them my way. I do like to thank people with a nice referral. Thank you. So that will be in my appreciation for you sharing this concept with others and sharing my content with others. Of course, if you're seeing this as part of a paid program, don't just leak this to them. Have them request to enroll as well. All right, everybody. Thanks so much for being here. Appreciate you. Take care. As I always say, together we are even more brilliant.